Thank you very much. Now, for today's first keynote, Johan Kuylenstierna is a research leader at Stockholm Environment Institute and a member of the Scientific Advisory Panel of the Climate and Clean Air Coalition, CCAC. His key areas of interest relate to atmospheric issues, including air pollution and climate change. His focus is on the linkages between climate and air quality, and air issues that range from regional to global scales, namely the impact of gaseous and particulate pollutants on crops, forests, and human health. Today, Johan will talk about the link to climate change and need for global response. If you have questions for Johan, please make sure to raise them on the livestream website page. It is a great privilege to welcome, all the way from Sweden, Johan Kuylenstierna.
I hope you can hear me well.
Yes.
Thank you very much for inviting me to these Nordic talks. My name is Johan Kuylenstierna. I work for the Stockholm Environment Institute, which has headquarters in Stockholm and centers around the world. Now, it's very nice to be able to talk to you in this forum. We have the pleasure of working with several colleagues in Korea, with urban governments in the Seoul metropolitan region, and other collaborations with the Korea Environment Institute and Green Technology Center. But I won't be talking about that today. Today, I'm going to be talking about the link between climate change and air pollution and the need for a coordinated response. So, the first thing to say is that air pollution and climate change are strongly linked. Partly, there are a number of substances which act both as air pollutants and which act as agents warming the atmosphere. So, for example, we have methane, which is a greenhouse gas, but it's also one of the main precursors of the formation of tropospheric or ground level ozone, which has impacts on health and crops. Also, black carbon warms the atmosphere and is part of PM 2.5. But the other main linkage is that the same sources of air pollutants are the same sources as the main greenhouse gases, especially carbon dioxide. So there are these different linkages between them, and it makes it more sensible to deal with these issues together. And this can be illustrated by the health benefit that can come from the climate mitigation. So this is some work from the Joint Research Centre in the European Union. And it showed that with the previous set of NDCs, so this is the 2015 INDCs, that if those were fully implemented, it would lead to almost 500,000 fewer premature deaths. So we heard in the introduction that, air pollution causes these massive health impacts, about 7 million from indoor and outdoor exposure. Well, 500,000 could be reduced from the climate actions in the NDC. Now, if we were to increase ambition to 2 degrees C, of course, we're aiming for 1.5, then it goes to 1 million, and presumably 1.5 would be even higher. So we can really reduce the air pollution impacts through climate action. And this just shows to emphasize how linked these issues are. Now, I was involved in some work which was developed by UNEP and the Climate and Clean Air Coalition and published a couple of years ago, and you can see the link at the bottom. And this was looking at science-based solutions to air pollution, but also looking at the climate change linkages. So this showed that between 2015 and 2030, if nothing had been done, there would have been a massive increase in air pollution across the whole of Asia. Now, this is the population weighted mean PM 2.5 concentration for Asia. But this first bar shows what has already been done in Asia. So people have not been doing nothing. People have been trying very hard to reduce air pollution. And this has brought it down to the anticipated increase here. But there are also many measures and policies in the pipeline, which means that once those are fully implemented, we more or less get to the same position that we're in today, which is obviously not good enough. So then we have a series of other measures which will pull down the air pollution. And especially this last link between, looking at the broader development priorities and how they affect air pollution. And it means that there is the opportunity with existing measures, policies to mitigate air pollution and bring up to 1 billion people below the 10 micrograms per meter old WHO guideline. Now we have a new WHO guideline. It's got stricter, down at 5 micrograms. But still, there is a large opportunity in the next 8 years to significantly reduce air pollution. But what's interesting is that this could also avoid 0.3 degrees C of warming by 2050. So whether you come from the climate change mitigation, there are massive health benefits from reduced air pollution, or you focus on air quality improvements and you get an improvement in the warming, a reduction in the amount of warming that we would see. So this shows just how closely linked these issues are. Now, in last week, the COP finished, and I was there, and there was, I would say, a big increase in the interest in the health benefits related to climate mitigation compared to previous COPs. We had a discussion with someone from the World Health Organization who said that previously we were chasing people to put the health argument into climate. Now they're chasing us. This doesn't mean to say that, the penny has totally dropped in terms of the importance of including health in climate mitigation policies, but it's getting there. It's certainly increased. And this can be seen if we look at the NDCs, the most recent NDCs. So colleagues at the Stockholm Environment Institute have been looking through all of the NDCs and pulling out the number of countries that highlight the benefits that their NDCs will give for air quality and health. Now you can see that twice as many, or more than twice as many countries are now mentioning health in their NDC, so in their climate plans. Interestingly, a fair number of these are partners of the Climate and Clean Air Coalition, which has been championing this linkage for almost 10 years now. But it's not just whether they mention air quality and health. The NDCs mention specific measures, even if they don't mention air quality per se. So if we look at measures like reducing the open burning of municipal solid waste or agricultural waste burning, or increasing efficiency of polluting industries, or the residential sector, which is really important across Asia, moving to cleaner cooking fuels, or indeed looking at transport, then we can see all of these will, have an impact on climate change, but they will have a massive impact on air quality. So if we look at that, we can see that there has been a consistent increase in the number of countries that are including these important air quality reducing measures in their NDCs. So there is an increase in the link between the climate policy and health. So then we move to the Climate and Clean Air Coalition. And one of the things that we've been doing is trying to enhance the capacity of countries to be able to plan integrated air quality and climate change planning. And this is just an idea of the countries that we work with. And mainly we're looking at things like developing emission inventories and emission mitigation plans using a tool called LEAP that we have within the Stockholm Environment Institute. Anyway, if you look at some of the NDCs, you can see that some of them are emphasizing the health benefits of their NDC. So Nigeria's NDC, the plans would avoid 30,000 deaths from indoor air pollution reductions alone by 2030. Ghana's NDC quotes that 2,900 deaths would be avoided from outdoor air pollution, and even Togo, mentions the number of reduced premature deaths that would be achieved. But we need to give the ability of countries to generate these integrated plans, and that's something that we've been trying to do, but there's a long way to go. And many countries still rely on consultancies to produce low emission plans, and now we're moving towards an annual accounting of the NDCs. Really, we've got to make sure the capacity of these countries to develop integrated inventories and mitigation plans is important. So now I can see I'm running out of time a bit, but just like to mention some other interesting things. One is that there was an increased interest in the private sector and what they can contribute to not only addressing climate change, but also air pollution. So a lot of the sources of air pollution come from industry, and we're currently working with the CCAC, that's the Climate Clean Air Coalition, and IKEA, and the World Economic Forum as well, to disseminate and link to other companies. We're developing methods by which they can add air pollutants emissions to their value chain analysis, carbon analysis. So this is something that IKEA wanted to do, and they have plans to reduce the carbon dioxide down their value chain, but they want to be able to quantify and address air pollutant emissions down their value chain and work with suppliers to reduce those over time. And then the last thing I'd like to talk about is the issue of methane. So we have a global methane assessment. It was a multi-author assessment organized by the Climate Clean Air Coalition. There is a decision tool that you can look at as well. And what it was addressing was that methane has increased, the concentration has increased rapidly, and it continues to increase. But if we're going to hit 1.5, then we need to dramatically reduce the concentration and address emissions very quickly. But what's interesting is that if we address methane, we also address ozone. So if we could reduce the amount of methane from the agricultural waste and fossil fuel sectors successfully and achieve, say, a 45% reduction from what it would be to a level which is consistent with 1.5 degrees C mitigation, we also get massive health benefits. So we get avoided deaths from ozone pollution. We get over 250,000 avoided deaths globally. And we'd also avoid other health impacts like asthma attacks. So you'd avoid over 770,000 hospital visits due to severe asthma attacks, but also 26 million tons of avoided crop losses. And then, of course, there are health impacts related to heat as well. So you get lost work hours avoided, 73 billion lost hours of work avoided from those people working outside due to heat exposure. And I'm sure you all heard about the Global Methane Pledge. So this is a welcome step, countries joining, that's over 107 countries, to reduce methane by at least 30% by 2030. And this would both reduce the threat of climate change and it would reduce ozone pollution. So, in conclusion, we have progress on these short-lived pollutants. I didn't go into the importance of those. If we reduce methane, then not only do we get reduction in ozone, but we get a more rapid reduction in warming because the lifetime of methane is less in the atmosphere. But anyway, progress on methane, on SLCPs, the short-lived climate pollutants, and integrated air pollutant climate change planning, it's starting to happen. It's starting to, the links becoming clearer, but there's a long way to go. But we need to make sure that the planning for emission reductions becomes institutionalized, made easy to update, especially if we're going to annual updates of the NDCs. And the health benefits are increasingly part of climate discourse. And partly this is because a lot of people are more worried about health than they are about climate. People are worried about climate, but they're also extremely worried about health, especially in those parts of the world where we have very high air pollution. And this is a great benefit also for climate change mitigation. If we can emphasize the health benefits, then we might get more ambition. Black carbon mitigation, the countries are very interested to local benefits, but they need support, in developing countries especially, and it really can increase climate ambition. Emissions tend to be decreasing, not everywhere, but in most places, but there needs to be more action. And methane, the emissions are increasing rapidly, but the opportunities are huge to reduce it. It's fairly cheap to reduce compared to many things. So the pledge is a great first step. I think we should need more ambition. There's more opportunity, and it will reduce ozone pollution and the health impacts. So thank you very much, and I hope I didn't go too far over time.